Hey guys, this is Emily, and I will be presenting on the bilingual cycles approach. Okay, so I know all of us are familiar with the cycles approach, and so we're just going to be kind of building on that. So to quickly brush up, we know that our cycles, we're going to move through different phases of exposing the child, presenting the child with these concepts. We want to pick stimulable patterns, but we also want to challenge them and pick things that need to be worked on. So you're thinking about how generalization is going to be the long-term goal. We're not expecting them to master everything right away. We just want to drill, repeat over a period of time. They're going to generalize that, and that's the goal. So we can add that, change it up over time, but it's a lot of just prolonged exposure, practice, and gradual learning. Again, same with the traditional cycles approach. This is all the same right here as far as what intervention looks like on a timeline, how often, how much. You'll have an hour or two therapy a week, ideally 5 to 16 weeks. Again, beginning with those stimulable sounds. So you want to get them started with something that they can work on, that they can do. But again, that idea of the zone of proximal development, you don't want to push them too hard where they're disinterested, unmotivated, and they're withdrawing. And an important thing to note is that you want to have about 60 minutes for each phoneme target and have about 2 phonemes per target pattern. You want to have more than just one because you want to be able to work on that pattern in more than one setting or more than one example of phoneme so they can generalize that pattern across different phonemes. So that's important to consider as well. Okay, so the main gist of the bilingual cycles approach is that you're building on the traditional cycles approach and you're incorporating like kind of the philosophy and the ideas of the bilingual approach and this cross-lingual approach. So I'll kind of break those down and then we can kind of see what that looks like. So when you're thinking about a bilingual approach, you are focusing on shared sounds in both languages when you're picking targets and when you're doing treatment. So this isn't just acknowledging that the kid speaks Spanish. This is you're actually picking targets and you're actually working on them in therapy. So you're not just treating in English, but you're treating in English and in Spanish to generalize that skill across both languages. So you're like knocking out 2 birds with 1 stone. And when you do this, you want to look for patterns in these errors in a sound or in a pattern it's happening in both languages. So this can be really effective when you see a kid has like the same deletion patterns in English and in Spanish, or that they're having difficulties with clusters in English and in Spanish. If you work on them in both languages, you can help generalize them into both languages. Whereas if you just kind of close your eyes and hope that working on it in one language will generalize to the other, that's different than actively targeting it in both languages. And so when you're doing this, you want to consider the proficiency of the speaker. Is it even worth it to work on, is it going to be productive or fruitful to target Spanish? Or what's their L1? What's the L2? How does the family think about it? Those are some cultural considerations to take into account when you're thinking about those things. And when you think about the cross-lingual approach, that is a little more, you're just kind of considering, okay, my client speaks English and Spanish. I'm going to take the consideration, understand that I know that they speak Spanish, and I'm going to look at what's going on in their English, and I'm going to say, okay, I think this is happening because they're generalizing this rule in Spanish, and you're using that background knowledge to support their treatment. You don't necessarily have to be a Spanish speaker or bilingual to do this. This is kind of just that you're looking at the child as a whole and you're taking into consideration what the kid is bringing to the table with that other language that they speak. And so, this really talks about the strengths and the uniquenesses of that other language and how you can use those to pick targets and to kind of problem solve what's going on with that child's language. Okay, so when we talk about what are our shared sounds, what are going to be our shared targets in English and in Spanish? Well, we already know that most of our sounds are acquired by age 5, and this happens across 27 different languages. And so we have our handy dandy little chart right here. And when we're looking at these, we want to be looking at similar patterns and similar acquisition ages in both languages. So we can kind of assume, okay, just have that thought of I'm going to be looking for the same things in both English and Spanish. And this slide right here, these four targets for cycles approach are like optimal first targets. These are from traditional cycles approach, and these in particular are exactly the same for our kids that are bilingual because these are all things that develop similarly in Spanish. So we can know that, okay, these check, these work. I don't got to worry. This is appropriate. So just keep that in mind when we're thinking about this as well, that a lot of these are similarly developing anyways in Spanish and English. Okay, so when we're thinking about what is a way that bilingual cycles approach is even different than traditional cycles approach, well, it could be in a lot of small little ways, really, because if you're looking at, for example, if you're looking at prioritizing front-back contrast, so you have your pool of phonemes that you can pick. Well, you want to make that pool a little smaller when you're looking at what are those shared sounds, and then you pick out of those shared sounds first. That could be an example of that. Similarly, if you are adding stridents and palatals, you want to make that pool a little smaller, and you want to say, I'm going to pick those sounds first that are in Spanish and in English. I think that's a pretty good way of explaining how you might prioritize those targets to target that English and Spanish at the same time. Okay, so when we're thinking about what this looks like in therapy and how to pick target words, it's going to be very similar to the traditional cycles approach. You just are going to put your thinking cap on and you're going to be thinking with a couple extra layers on. So I have over here on the left, 1 through 4, I've picked 4 patterns we're going to work on for this child's first cycle. So we're going to have S clusters, velars, liquids, and final consonants. For the S clusters and the velars, we're going to want to think about what kind of targets and what kind of words in Spanish that we could use this in English and in Spanish to kind of generalize. So ST and SP are good clusters for Spanish because they're more common. And then the velars K and G develop at the same time or similar time to English. So those are good ones to pick when you're thinking about which sounds would serve my client best if they're bilingual and I'm wanting to generalize to both languages. When thinking about liquids, we think back to that 2 phoneme rule, right? So in one of our earlier slides, we talked about how generally in cycles you want to have 2 phonemes per pattern. Well, English R isn't present in Spanish, but hey, that's okay because in bilingual cycles approach, you don't have to just pick sounds that are in both languages. You can still work on other sounds that child needs and their English language to be successful in the classroom and to help with their social skills and their communication in general. So that's fine. You can work on L in Spanish and in English, and you can work on R as well. And when you pick final consonants, you want to consider that in Spanish, a lot of words, there's a lot fewer final consonant sounds, and a lot of the times they might be S or Z. So maybe that's a good first target for that pattern because it's really common and it's more stimulable maybe for that child if they're using it a lot and they hear it a lot. But one consideration of this is that you want to consider their dialect. So we talked about this a little bit in class, but especially with S's and S clusters, a lot of people don't use, they might omit that S. So personally for me, when I say estrella, I say estrella, I say está, and I omit that S. But if I were to hear a child that were omitting all of their final S's or their plural S's, that doesn't mean that they don't have that grammatical concept of possession or plurals. That just might mean that they have a dialect that omits that S, and that's their background, that's their story. And so that's something really important to consider when you're working with bilingual kids is where are their dialects and like what does that look like when you're applying it to their language skills. Okay, thank you for watching, and that is my presentation on the bilingual cycles approach. And here are my sources. Thank you.